In this 30-minute hip opening class, you get to experience different openings, movements, which are related to the hip flexors, they're related to the external rotation. And by doing this practice regularly, you will definitely prevent lower back pain. So sit down, take these 30 minutes for yourself, and enjoy the class. And if you like it, remember to subscribe and join my channel. Close your eyes, sitting in Virasana. Ideally, if you sit on something, if you sit on the floor, you can also sit with your legs crossed, whichever position is comfortable for you. And then close your eyes. Take a slow, soft inhalation and a long exhalation. Come into your body and breathe. Let everything which happened before you came here to your mat today go. And also let everything go which is still to come later on. Bring yourself completely into this moment so that there's nothing else you need to do. Let just be. Be with yourself. With your next exhalation, drop your sitting bones down into the earth. And then inhaling, lift a bit of the abdomen, lengthen the sides of your waist. Roll your shoulders back, drop the shoulder blades down as you exhale. Inhaling, lift your collarbones, open your chest. And as you exhale, release the skin of your back down. As always, front body open, back body relaxed. Upward is a action, downward is a release. Inhale again. Exhale, relax your jaw. Now slowly take your gaze into the heart center. Connect with the light inside. With your next inhalation, lift your arms for mental centering. Listen to your thoughts. As you exhale, center your mind, gather your mental energy. Inhale, and down on an exhalation, move your mind into your heart center, releasing all your thoughts. Lift your hands again, inhaling, and an exhale, center. Come into a space of calmness. Inhale, and down on the exhalation. Go inside the heart to feel a bit more present. One more time, lift your hands again. And then exhaling, center the mind. Inhale, and exhaling down to your heart. Go inside again, feeling the light in you. With your hands in Namaste, please join me for 3 ohms. Exhaling, gently bow your head. Look inside your heart. Setting your intention for why you came here to the mat to watch this video. With that intention in your heart, lift your head, open your eyes and release your hands. Coming into Parvatasana, lift your arms, turn the palms up to the ceiling, spreading your shoulder blades. Drop the chin down and keep your inner thighs together, deepening the groins, dropping the inner thighs down as you lift and spread from the backside and lift. Long and deep breaths. Inhale again. Exhaling, take your arms down from the sides. Lift your head, inhale. Left hand to right, right hand behind you. Root and lift. Exhale, twist. Inhaling, come back, lengthen and twist. And then come back, straighten out your legs. Sit in Dandasana, pumping your quadriceps. Do that 9 times. Exhale. Inhale, release. Contract. And with every exhalation, find the depth in your groins. Moving the sitting bones back. Pulling the toes back to the knees. Last one. And then coming to Baddha Konasana. So since we're working a little bit in the hips, this is the first one. The hips usually take a little bit more time. It's not a quick fix usually if there's any tension. So we may hold it a little bit longer, but since it's only half an hour, not that long. Press your feet together, open up. Lift a bit of the abdomen, move the shoulder blades down the back. And then release your chin down. Now feel the state of your hips. Do they resist or are they able to let go? When you command them to go, it's always a good idea to talk to your body. It does listen. Yes, your hips release. It's okay. You don't have to hold on. It's almost like talking to a child. Talk to your baby, to your to your body. I'm teaching a lot of pregnancy classes, so we actually speak to the baby as well. But now it's about your body. It's like an own entity. Open up the soles of your feet, spreading your thighs, shoulder blades down. Spread a little bit more and then tilt forward, tilt towards the front. So as you put some weight in your thighs, if possible, if the legs are more up, it's also okay to have the hands on the floor, whichever works, even behind you, probably even better, to push yourself gently forward with a tilt. So the sitting bones still go down, but now the whole pelvis is like this, as if I use that pad, it's straight, and then I tilt it towards the front. And so the spine goes with the pelvis, not the spine alone. And then bring your feet together, close them, and come onto your hands and knees. Let's do a few rounds of Majarasana with your fingers spread. Your knees under the hips, hands under the shoulders, and then round on the exhalation. Hold this for a moment, lift your back, spread your shoulder blades. And then inhaling, drop the spine, open the chest, look up, and then hold it again. But keep breathing. Open your chest, shoulders back, and then exhaling, round, lift your back. Inhaling to arch, open your spine at the front, and then flow with the rhythm of your breath. Feel your spine. The hips are carrying the weight of the spine all the time. So when we mobilize the hips, the spine is happier. When we mobilize the spine, the hips get happier. And then inhale, come back to neutral, and then lie down on your back. So you may need a belt for Supta Baddha Bring your legs together.
So remember, the inner thighs should touch. And then lift your right leg up, either hold your big toe or put the belt around the sole. And straighten the arm. That's the most important, that the arm is straight. Contract your quadriceps. Push your heels away. So the left heel moves forward, and especially from the inside. And then working on stretching your hamstrings. And as a third action, move your right hip to the front. Breathe into that space in your right hip. Inhale. As you exhale, release. And change. Lift your left leg up. Contracting the quadriceps. Now, press out from your right heel, especially from the inside, because that keeps the rotation in the thigh. And as you open up your hamstrings, breathe into the back of the leg. Now move your left hip to the front. So inner right heel, strong, quadriceps active, and your left hip forward. Breathe deep into that. Long, deep breaths. Inhale again, exhaling, release. Now bend your knees, roll over to the right. Come up onto your hands and knees. So now I have prepared some blocks. So if you have the standing pose blocks at home, that's great. If you don't have these blocks, you can also use a chair instead. So if you use a chair, just put it in front here. It's just about that the hands are a little bit higher up. That's all. So bring your hands onto the chair or on the blocks, and then step your right leg forward, your left leg back, coming into Vanarasana. And then from there, put the blocks back so they come under the shoulders. Now root your left shin bone down, root your right heel down, let the pelvis drop. So your arms are basically there to keep you up so that you can work on releasing the pelvis. So inhale, as you exhale, release the pelvis down. Lift a bit of the abdomen, inhale, exhaling, drop the pelvis more. And then feel it sinking. Let it sink. Has this downward movement, but your upper body, your torso, is not going down because of the blocks. They keep you high, or the chair, whatever you use. And then feel, is the hip flexor here in the front as resistant as the hamstrings were, or are they different? Some people are open in the front and more tight in the back, and vice versa, or both, or none. We all have different kind of bodies. Release that pelvis down a little bit more. Release that left hip flexor. I do feel a stretch already as it's releasing. Yeah, you remember, you need to allow it to release. Inhale here, and then exhaling, step your right leg back and take your left leg forward. So again, checking that the hands are under the shoulders, your heel under the knee. So you may not see it completely, but here this has to be straight, not behind. This is a no, yeah? And then this also, this is too much forward. It's much more effective if it's right under. And then again with the hands under the shoulders. Rooting down from your right shin bone. Lift up from your torso by your arms and then release down. Let it sink. Let the pelvis sink. Do not let the leg come out to the side. Yeah, keep it in line so your left thigh bone is all the time aligned. Using the breath, and drop. And drop. And drop. It's not important if you look up. It's okay to look forward. It's not even important to work the chest up so much, since your arms are doing the job to keep the upper body up. So go down and down and more down. In addition to the bottom of the belly, also work your perineum up. So keep it all the time slightly lifted. 3 more breaths. down. Good. And then release, stepping back. Now put the blocks or the chair to the side. We'll need them again. And then come back into Marjarasana, rounding and arching your back. Inhaling, open the chest, pull the sitting bones back. Exhaling, front body up towards the back body. And then come to neutral. So now sit down. And then let's start sitting on one pad. It's good to be a little bit higher up. And then take your left leg under your right knee. I'm mirroring you now. So that the shin bone, if you look at the shin bone, is exactly the same line as the mat. And that's important. So don't pull it back. Yeah, so it's in line with the shin bone here, the mat. And then take the right ankle on top. So the ankle is on the other side of the thigh bone. So as you see, my knee is a little bit in the air. This one, or even the block, something under, will help so that I'm not unstable. So having a little bit of support under works really well. And then press your fingertips down. Keep your feet flexed. That means your toes are pulling to the knees and the heels press away. Press down. Lift a bit of the abdomen. Open your chest. And then breathe a few breaths, moving both sitting bones into the floor. Now take your right hand, externally rotate, and then lean back, and then press that right knee away, creating that external rotation. The knee goes down when it rotates out. It doesn't go down straight. That would damage the hip if we would just press it downward. Okay, so it goes out, away, and as it goes away, it goes down. So I take a little bit more, a pad under the hand as well. It's nice and it's not too deep. You can also stay on your fingertips, whatever feels good. When you lean back and then move that thigh bone forward. Breathe into the hips. They're already not resisting so much anymore when you give them a little bit time. At first they resist and then they're like, okay, it's fine. Nothing happens here, nothing dangerous. And then slowly come back and change. Take the leg to the other side. By the way, what I forgot to mention, but many of you who do this know it, if your leg is too high up like this, then you need to straighten one leg. Yeah, you get the same. I know many of you know this already, that you're doing it that way. So this time the right one goes under and the left one goes on top, or straight leg, of course. And you notice also how they are different. If one is a little bit more up than the other, which for me is very clearly, my right is more up. So press the fingertips down, lift the belly. I put this block behind on the other side. And then lengthen both sitting bones down. Breathe deep. Let your sitting bones drop, drop, drop. And lift up. Now with your left hand, externally rotate. And then lean back. And then external rotate even more, moving that knee away from your hip. Breathe into that space. Long, deep breaths. If you feel a lot of tension in here, there's often that prevention of the sciatica because the nerve runs through the piriformis, a muscle here in the buttocks. And when that muscle is tight, then the numbing in the leg happens because it presses the nerve. And this is also actually called the false sciatica. The real sciatica cannot be corrected with that because it's in the spine. But if it's false sciatica, this can take care of it. Yeah, so we are also having a special therapeutic application on this, which we sometimes do in class as well. But right now, just work on the external rotation and the belly up, moving that thigh away. And then slowly come back, straighten out your legs. And then it's a good time to pump, just pump 3 times. Good, so let's come back onto your hands and knees. So you'll need the blocks again, or like a chair, what I mentioned earlier. And then you may even need some support under. And I show you why. So take your hands on the blocks and then step your left knee back and your right leg forward. So now my right knee is completely straight, but the heel is here. And I can show you from the front. Okay, so the heel is in the groin. That's how it should look like. So it should cross over. And then walking the left leg back. So now if your sitting bones are not on the floor, put something under. Okay, so if the sitting bone is almost down, then it's fine. So now I take my blocks a little bit lower as well. So depending how high you are, tuck your toe under from the back, move your left hip forward, stretch it to the front, and then straighten the leg again. Press down into the blocks and then open your chest and look up. Move your right groin back. Okay, so under the right buttocks is where you need the blocks if you're unstable. For me, I'm stable, so I don't need it. But you please use it if you need it. And then open your chest and look up. So now the right groin is deep and the left hip moves forward. There's this tendency, which we often see in Instagram pictures and videos, that people move forward and lie down. As much as it feels amazing, it's not that good for the hip because it creates hypermobility. So the SI joint, all this area here is very vulnerable. And if we are moving in the wrong way, we can actually hurt ourselves because this is amazing back relief. And so if we do it right, the back will be relieved. So a few more breaths, deepening the right groin. Move your left hip forward, forward, and lift up. Lifting the pit of the abdomen. Feel that in the right buttock, that release, which we will be working on. And then, of course, the front left hip flexor is taken care of. Lift up and lift up a bit more. And then slowly come back and change. So I'm just going to lean over on my right and then come up onto the knees. Take your left leg forward. Your groin, the heel under the right groin. The left knee straight, the left thigh bone straight. And then again, coming down either on some support or something you need under the left buttock so that you feel stability. And then inhaling, lift. Oh yeah, tucking the toe under. This just brings the right hip a little bit more forward. And then I take it back, toes back, lift the belly. Open your chest, shoulder blades down the back. Breathe deep, deepening the groin, left groin. Let the left sitting bones sink down a bit more. Moving the right hip forward a bit more. And the shoulder blades going down the back. Long, deep breaths again. Few more here. Remember to feel, remember to stay present. And then slowly lean over onto the left side and come around. Good. So if you have these kind of blocks, ideal. If you don't have them, the pads also work. And if you don't have any pads, then please use books. You should find 2 books. You can always pause this video. Get 2 books which are the same size. And then lie down on your back. Like this. And then put the edges of the blocks on your buttocks. Or if you have the books there, Lexica works with it, a good old Lexica. And then try to completely release into those blocks. even if it feels painful. For some, it may feel painful. For some, I sometimes notice if it's very tight that there's a numbness going down my leg, but it's not numb, it's actually bringing more life into the leg. So find that spot and then release onto it. And for example, if you're on a spot which doesn't feel tense at all, it doesn't hurt at all, then find a different spot. Because there's for sure somewhere where it's because if you don't find a tight spot, there's no need doing this. So just keep moving around. Stay at it for about, I don't know, 6-9 breaths, something like that. And then when you feel like, okay, now I want to move on, then I move it either out to the right, down, up, inside. So around that where you started from. I started in the middle and now I move around that. And mostly I'm going to work myself out and more up, because here there's a muscle called the gluteus medius. The gluteus maximus is the buttock muscles. The gluteus medius are here on the side, and they are often very tight. For me, especially after when I'm doing like some other work than yoga, like strength work, squatting, lots of walking, even sitting. I've been sitting in a car yesterday for 2 hours. So things like that make all of this very tight. Now breathe into that and releasing that tension. If it feels very painful, it's really important that you do it more often. If it's not painful, then you're quite good in your hips. Most commonly, when I have a room full of people, nobody ever says there's no pain. So it's definitely from our habit of sitting that we create tension in the buttocks. So find a new spot if you haven't yet. Releasing. This is also a good time to soften the belly, which is always in action. You might feel some pulsing. Pum, 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 pum. That means that the blood tries to rush back into that area which has been stuck and less blood went through it. So we're boosting circulation. And of course, especially whenever you put weight on a muscle fiber, and now it's the opposite. The muscle fiber is on something. The muscle has to release. It cannot hold on anymore. And then find one more spot. I'm going even more outside. See where you feel you need it. And then breathe through it. The amazing part is the effect on the spine of this. Will feel wonderful afterwards. And then slowly lift a little bit, take the blocks away. Let your knees lean onto each other, so rest for a moment, feel your back on the ground. And then from there we go straight into Shavasana. So lift your buttocks with your hands, pull the flesh forward, and then straighten the legs. Remember, if you have any lower back pain, then take a bolster under. I move a little bit back because you want to be on your mat as well. Yeah, you don't want to be on the floor. And then hug yourself, take your shoulder blades apart and down to the sides, and then close your eyes. Take a deep inhalation. Exhale completely. Let go. Release the weight of your body down into the earth and relax. Notice if there's anything holding on, especially the jaw. Let it go. Take a deep inhalation. Exhale, let go one more time. Relax. Slowly bend your legs one at a time. Roll over to your right. Put your head on your arm. On your next inhalation, come up to sitting with your eyes closed. Bring your hands to Namaste. And join me for 3 ohms. Exhaling, bow your head. With a smile in your heart, lift again. Open your eyes and release your hands. Namaste.